Hey everyone, it's Isla, aka Chronic for You, and we are officially making long-form content now. In today's video, I'm diving into the world of medical dramas to see how they portray the chronic illnesses I live with, POTS and Ehlers-Danlos Syndrome. I also have the MCAS, but I couldn't find anything on MCAS. Let's watch together and break down what they get right and what they get wrong, and how close it comes to real life. Let's get started. The first clip we're going to watch is from Dr. House. Apparently it's a POTS diagnosis clip, so let's get to it.
Ted?
He's having another heart attack?
I don't think so. His heart rate seems normal.
Are you okay? You weren't discussing wedding plans, were you?
No. I guess I just...
Fainted.
POTS. Postural Orthostatic Tachycardia syndrome. BP plummets when he's upright, reverts to normal when he's lying down.
He was lying down both times we took his blood pressure.
Protracted hypertension could have induced his heart attack, also explains the syncope.
And his aphasia. He was upright, then you laid him down in the bed to test him. BP reverted to normal, voice came back, jabbing him with the needle had nothing to do with it.
POTS can be brought on by viral or bacterial infections such as mono.
Split him up with fludrocortisone. I'm missing something.
Okay, that was a little weird that they said POTS and not just dysautonomia, because it was kind of weird that they didn't mention anything about the heart rate and that they diagnosed him with POTS just because he kept passing out. But they just mentioned that his blood pressure plummeted, but nothing about his heart rate, so maybe just a form of dysautonomia and not POTS, because POTS has the T for tachycardia. I don't know, it seemed a little to me. But I did like that they mentioned that POTS can be brought on by like viruses. There's so many different ways a person can develop POTS, whether it's from a comorbidity of a condition, like I have Ehlers-Danlos Syndrome, or post-COVID POTS. People have developed POTS because of concussion. There's many reasons why a person may develop POTS, so I did like that they mentioned that. So this next one is from Grey's Anatomy. It is focused on Ehlers-Danlos Syndrome. Patient named Emma comes into the emergency room. She basically says, like, give me an IV, that's all I need, it'll make me feel better. And they start accusing her of being an alcoholic, and that brings us to the video clip.
I get dehydrated and I get sick. I know how to fix it. This is how I fix it.
Totally understand. You know your own body better than anyone.
Exactly, and I don't need some idiot telling me I have a problem when I don't.
Hey, you know how to handle it. You know your own limits.
It's doctors like him that are the problem. He thinks I'm some crazy party girl. I'm not an alcoholic.
You know, I used to tell myself that. Well, actually, quite a bit. Talked a lot about that in AA.
AA? Really? What is this? Are you trying to play good cop, bad cop with me or something?
No.
I am not stupid and I won't stick around for this. No thanks.
Emma, wait a minute.
What did you do?
I just barely touched her.
Emma, just calm down.
Don't touch me. Just let me fix it.
Oh my God.
What on earth?
So, can I get out of here now?
I got your message. What's so urgent?
Check it out. So you know how Emma presented with a hangover but insisted that wasn't it?
Yeah, even though she was in the clinic every couple of weeks for IV hydration?
And she said that thing with her arms has happened to her before.
You know, what does this have to do with me?
Well, I just need the chart. Look at her list of symptoms. I mean, there's something wrong with her, but she's not an alcoholic.
Dehydration, bruises easy, joint hypermobility, that's for sure. Fainting, spit. Ehlers-Danlos Syndrome?
You're not as strong as you think.
I've only encountered a couple cases in my career. I mean, we'll have to run tests to confirm it.
What?
But if you're right, she has this. Karev, you may have just saved this girl's life. Did you tell her?
Okay, sorry, I started laughing when he says he's only seen a few cases because hypermobile Ehlers-Danlos syndrome seems to be a lot more common than people think. So I just wanted to interject that. But going back, so a lot of people who are diagnosed with EDS and POTS do not get their diagnosis right away. And that was very clear in this situation, which I really like that they portrayed that, because there's a ton of medical gaslighting when a patient presents with a constellation of symptoms that just don't really make sense for a young, healthy person. And so for myself, I started showing symptoms as early as a 1-year-old when I couldn't even walk because my hips were too flexible, to when I was 7 and having dizzy spells, and I wasn't diagnosed with POTS, EDS, and MCAS till I was 21. And I was put on anxiety medication, gone through therapy, and all of that just because everything that I was going through was supposedly caused by anxiety. But now I know that is not the case. There's a few things wrong with this, but I really do like because it does portray how hard it is to get a diagnosis when it comes to these types of chronic illnesses. I also like how her shoulder popped out. It was like, this wasn't her first time. Like, she's clearly been dealing with this for a long time, and all of us, we deal with these symptoms for so long before we get medical treatment, and we just learn how to cope with them. So, it kind of passed the test for me. I'm sure people who watched this episode felt a little bit seen. Let me know what you think. So this last one is also about Ehlers-Danlos Syndrome. It is from The Resident, which I just binged. I loved the show so much. It was a little dramatic and not always accurate. Well, most medical shows aren't. I really liked it because one of the main characters, Dr. Conrad Hawkins, listened to all of his patients, wouldn't sleep till he found a diagnosis. And I think that's why a lot of people with chronic illnesses like to watch these medical shows, because a lot of the times the doctors on the shows really try to figure out the mysteries with their patients, and we wish that we had that in real life rather than just being passed on to specialist and never getting any answers. So here's the clip.
The cops said you once crammed yourself underneath the kitchen sink for hours during a home invasion. That true? Do you ever get pain in your knees and joints?
Yeah. Always. How does she know that?
That hurt?
I don't know.
Elastic skin, abnormal flexibility, atrophic scars, and pseudotumors. I think you might have Ehlers-Danlos Syndrome. They call it the Stretch Armstrong disease. It is associated with aneurysms. They can burst at any time. Do you have kids?
A daughter.
Ehlers-Danlos is genetic. She has aneurysms. It can be very dangerous. She's going to need aggressive surveillance.
Means she can die.
Yes. But I can manage her care.
Wait a minute.
I like to...
But they don't know what form of Ehlers-Danlos syndrome he has. If it's vascular Ehlers-Danlos syndrome, then yeah, that's a scary one. But if it's just hypermobile Ehlers-Danlos syndrome, it's not deadly per se. Like, I remember when I was first diagnosed with Ehlers-Danlos syndrome, one of my mom's friends was like, your daughter doesn't have that, that's deadly, so-and-so died of Ehlers-Danlos syndrome. People don't understand there are different forms of Ehlers-Danlos syndrome, and they all have different severities. Just by the exam that he gave, that's, you can't diagnose someone like that. There doesn't work like that just by the stretchy skin. You can be hypermobile and not have Ehlers-Danlos syndrome. You can be stretchy and not have Ehlers-Danlos syndrome. People can just be stretchy. So this was a very fast and inaccurate diagnosis. So what did we learn today? We learned that illnesses aren't always portrayed accurately in medical shows, which we knew. We all knew that. It is really nice, though, when you have a chronic illness to see your illness on TV. It makes you feel kind of seen, especially when it's an illness that isn't talked about often. POTS and Ehlers-Danlos syndrome is talked about more now. There's been a lot of awareness, thanks to y'all. I don't know. When I saw these, it made me feel good, but also like, let's check our facts, people. But they do that with all the illnesses, and they dramatize and they simplify, because they're not going to run us through the actual entire test to test this guy for Ehlers-Danlos syndrome. And they're not going to get into the nitty-gritty, because most of the time people who do watch these shows, they don't know the actual facts, so it's just entertaining and it's fun to watch. Anyways, I enjoyed making this video. I hope you enjoyed watching it. I'm not used to long form content. I need ideas. The podcast episodes will be launching soon. We have a ton of fun people coming on the show. Oh my gosh. And they have illnesses that you have, and they're doing great things and raising awareness and you probably know a lot of them. So stay tuned, and thanks for watching. See you next time. Bye!